One of the first patients I took care of was the proverbial rocket scientist. He had moved to work at NASA when he was in his 20s, back in 1960. He was one of the original aerospace engineers on the Apollo program, and then had moved into really the groundwork of the shuttle. And so basically this man had, helped America's space program be what it is. And unfortunately, he was coming to me because he heard that I took care of people with memory loss. And I'll never forget, he came into my clinic and very proudly, but of course sadly, opened up a spreadsheet. And he's the one who taught me the engineering term nominal variation. I will never forget this because he said these were the nominal variations in his memory over the last 2 years. That turned out to be the data that really demonstrated that unfortunate change in his intellect. When we did his cognitive testing, he clearly had a pattern of memory loss and some deficits in language and executive functioning that tipped me off even that first day and made me pretty worried for what the eventual diagnosis would be. But we moved on like you should with blood test and a picture of the brain, and all of that information eventually culminated in my knowing with as much certainty as I can that this was probably the early stages of Alzheimer's disease for this gentleman. And so the next visit was the day I brought him back. His wife was there, and had to tell him that this is what I thought the diagnosis was. Looked right at him and told him that I did think it was the early stages of Alzheimer's disease. And without hesitation, he said, "Well, is there a cure for that?" So of course I, took a gulp and said, "No, there's not." And he, again, without hesitation and without flinching, said, "Well, that's okay, Doc. I'm assuming you know what to do about this." And from that point on, I really understood that patients, yes, they want cure just as much as I want cure. Their family wants cure. But he taught me a very valuable lesson that where there isn't cure, our role doesn't stop there. In fact, in the case of Alzheimer's or the other dementias where we know these illnesses are going to last for years, and there's going to be any number of medical complications that are separate from the dementia or complications that come from the Alzheimer's disease or the dementia, that's what they're coming back to us to ask, now what? What do I do about this symptom? The caring for someone doesn't stop because we have diagnosed an illness with no cure. I get nervous making that diagnosis every single time. And I go back and I check and I make sure, did we think about this? Did I think about that? Did we check this possibility? Because I certainly want to make sure that, when I make that diagnosis, it's correct. But when I do make that diagnosis, I always have in the back of my mind that I want to almost immediately, tell the patient and the caregiver that there might not be a cure, but we intend fully, as your healthcare providers, to be there along the way, along the course of this illness, to help care for you. They really need the hope that someone is out there working with them to help make their days as quality as possible. We've got strategies for helping you figure out how you can be available to your patient to help them through, be their source of hope, be their source of comfort through this chronic and devastating illness, but don't feel like you have to do it yourself. I'll be your curbside consult. We've got the Alzheimer's Association and their resources. We'll help you along the way. And AlzTogether, I had to say it, I think that we're going to be able to do a lot to really change the course of how individuals with this illness and their families feel cared for.